Can older women still experience intense orgasms, or is that something that quietly fades away with age? If you're a woman over 40, 50, 60, or beyond, you may have wondered this yourself. Maybe your body feels different than it used to. Maybe desire doesn't show up as easily, or sensations feel unpredictable. Or perhaps you've heard whispers online from friends or even from healthcare providers that this is just what happens as you get older. But what if I told you that those assumptions are not only incomplete, but often wrong? Many women feel embarrassed asking these questions. Others worry something is wrong with them. And far too many quietly accept changes in their sexual response without realizing how much can still be improved, supported, and enjoyed at any age. Here's the truth: sexual pleasure is not reserved for the young. In fact, for many women, orgasms can remain strong or even become more intense with age. The key is understanding what actually changes in the body, what doesn't, and how to work with your physiology rather than against it. Today's video is about science, reassurance, and empowerment, not hype, not shame, and not unrealistic promises. Whether you're partnered or single, sexually active, or just curious, this conversation matters. So stay with me, because what you're about to learn may change how you think about pleasure, aging, and your body altogether. Hello, I'm Dr. Thomas Spears, MD. I'm a physician with a focus on women's health, aging, and sexual well-being across the lifespan. For decades, sexual health in older adults, especially women, has been overlooked, minimized, or misunderstood. Many women are told that changes in desire or orgasm are simply part of aging and nothing can be done. That message is not only discouraging, it's medically inaccurate. In this video, we're going to talk openly and respectfully about a question I hear often in my medical practice. Can older women still have intense orgasms? We'll explore what actually happens in the body as women age, how hormones, blood flow, nerves, and the brain all play a role in orgasm, and why intensity doesn't automatically disappear with time. We'll also talk about common myths, practical strategies, and when it may be helpful to seek medical support. This is educational content designed to inform and empower, not to pressure anyone into feeling they should experience pleasure in a certain way. Sexual well-being is personal, and it evolves over time. If this is your first time here, I encourage you to subscribe to the channel. We talk about real health questions for adults over 40, clearly, respectfully, and based on medical science. And if this topic resonates with you, you're not alone. Let's begin. What changes with age and what doesn't? One of the biggest misconceptions about sexual aging is the belief that everything declines across the board. In reality, aging brings changes, not automatic loss, hormonal shifts. As women approach menopause and post-menopause, estrogen and progesterone levels decline. Estrogen, in particular, plays a role in vaginal tissue health, blood flow, and lubrication. Lower levels can result in dryness or sensitivity changes, but that does not mean orgasm becomes impossible or weak. Orgasm intensity is not driven by estrogen alone. It also depends on nerve sensitivity, pelvic muscle engagement, blood circulation, brain stimulation, and emotional safety. Many of these remain intact or can even improve with age. The nervous system remains responsive. The nerves responsible for orgasm do not turn off after menopause. With adequate stimulation, arousal, and comfort, nerve pathways can remain highly responsive well into later decades. Experience can enhance pleasure. Older women often report something younger women lack: better communication, greater body awareness, less performance anxiety, stronger emotional connection. These factors can significantly enhance orgasm quality, sometimes outweighing physical changes. In short, aging changes the landscape, but the capacity for pleasure remains. The brain is the most important sexual organ. When we talk about orgasm, we often focus on anatomy, but the brain is the command center. Mental and emotional factors, stress, fatigue, self-consciousness, and unresolved emotional concerns can strongly influence orgasm intensity. Many women in midlife and beyond experience caregiving stress, work or financial pressure, body image shifts, relationship changes. These factors can dull arousal, not because the body is failing, but because the nervous system is overwhelmed. Confidence matters. Women who feel comfortable in their bodies tend to experience stronger sexual response. Interestingly, many women report increased confidence with age, even as society suggests the opposite. Desire evolves. Desire may become more responsive rather than spontaneous. This means arousal may build after intimacy begins, not before, and that is completely normal. Understanding this shift often removes unnecessary worry and allows pleasure to develop naturally. Medical conditions and medications that can affect orgasm. It's important to acknowledge that some factors can interfere with orgasm intensity, but many are manageable. Common medical contributors: diabetes affects nerves and blood flow, high blood pressure, pelvic floor dysfunction, chronic pain conditions, medications. Some medications, including certain antidepressants and blood pressure drugs, may reduce orgasm intensity or delay response. This does not mean you should stop medication, but it does mean these effects can be discussed with a healthcare provider. Alternatives or adjustments are often available. Vaginal health matters. Conditions like vaginal dryness or tissue thinning can make stimulation uncomfortable. When discomfort is addressed through moisturizers, localized treatments, or medical guidance, pleasure often improves. Tips: safe, practical ways to support intense orgasms at any age. Here are medically sound, non-explicit strategies that many women find helpful. Prioritize comfort, address dryness or irritation early. Comfort allows the nervous system to relax and respond. Strengthen pelvic floor muscles. Gentle pelvic floor exercises can improve muscle coordination and orgasm intensity over time. Slow down arousal. Longer warm-up time is normal and beneficial. Rushing often reduces pleasure. Manage stress intentionally. Deep breathing, mindfulness, or relaxation before intimacy can significantly improve response. Communicate needs clearly. Whether with a partner or healthcare provider, communication is essential. Stay physically active. Regular movement supports circulation, hormone balance, and mood, all important for sexual health. Myths versus facts. Myth 1. Orgasms naturally weaken with age. Fact: many women report equally strong or stronger orgasms later in life, especially when comfort and communication improve. Myth 2. Menopause ends sexual pleasure. Fact: menopause marks a hormonal transition, not the end of sexual response or enjoyment. Myth 3. If desire decreases, orgasm is impossible. Fact: desire and orgasm are related, but not identical. Many women experience orgasm even when desire feels different than it once did. So, can older women still have intense orgasms? From a medical standpoint, the answer is yes. Aging changes the body, but it does not erase the nervous system, emotional connection, or capacity for pleasure. In many cases, what's needed is understanding, reassurance, and the right kind of support, not resignation. If you've noticed changes, that doesn't mean something is wrong. It means your body is evolving, and learning how to work with those changes can make a meaningful difference. Sexual health is part of overall health. It deserves attention, respect, and honest conversation at every stage of life. If you found this video helpful, please like it. It helps others find accurate information. Subscribe to the channel if you want more evidence-based discussions about health, aging, and well-being. And feel free to share this video with someone who might benefit. I'd also love to hear from you in the comments. What questions do you have about sexual health and aging that you wish were discussed more openly? Thank you for spending this time with me. I'm Dr. Thomas Spears, MD, and I'll see you in the next video.